8 symptoms of pancreatic cancer that will shock you, critical warning signs. Most people don't realize that pancreatic cancer is one of the most dangerous cancers today, quietly killing more people than breast and prostate cancer in many countries. What's even more worrying is that it gets very little attention from the public, even though cases are increasing. Here's something important. By learning just a few key warning signs, you can help yourself or someone you care about catch this disease early, when treatment might still help. Pancreatic cancer is often called a silent killer for good reason. With only about 12% of patients surviving 5 years, it's very good at hiding in the body. It kills over 65,000 people each year in the U.S. alone. What's scary is that nearly 80% of patients ignore early warning signs, thinking they're just minor problems or everyday aches and pains, until the cancer has already grown and spread. But here's something important to know. Research now shows that many of these symptoms begin showing up 3 to 6 months before doctors make a diagnosis. This gives us a rare chance to catch it early. Your pancreas may be small and hidden deep in your belly, but it has a huge job. It helps control blood sugar and makes important enzymes for digestion. Because it's so well hidden, tumors can grow quietly without setting off immediate alarms. This makes it even more important to recognize subtle warning signs. In this information, we're going to share 8 surprising signs of pancreatic cancer that you might not expect. Some are so common that they're often completely ignored. Here's the breakthrough. According to recent scientific research, recognizing just 3 of these symptoms together could improve your chances of catching it early by nearly 70%. Why does such a deadly disease stay so hidden? Why isn't this knowledge part of everyday health conversations? Let's start with the first critical sign. 1. Digestive problems. Pancreatic cancer can seriously mess up your digestive system in several connected ways. The pancreas plays a key role in digestion by making important enzymes that help break down fats, proteins, and carbohydrates so your body can absorb and use them. When a tumor grows in or near the pancreas, it can interfere with making these enzymes or block the pancreatic duct, causing a chain reaction of digestive problems that can be both uncomfortable and worrying. As the digestive process gets weaker, food may stay in the stomach without breaking down properly, leading to constant nausea, vomiting, bloating, and an overall feeling of digestive upset. Over time, this disruption creates a noticeable drop in appetite as the body struggles to process nutrients properly. This often leads to unintentional weight loss, muscle wasting, and nutritional deficiencies, further weakening the body's strength. One particularly telling sign of poor digestion is a clear change in how your stool looks. Because the body can no longer properly break down and absorb fats, stools may become pale, greasy, and unusually bad-smelling, a red flag that's often overlooked. This isn't just a minor digestive annoyance. It's the body's way of signaling that something deeper is wrong. Recognizing these digestive changes as potential warning signs of pancreatic cancer could make a life-saving difference. While they might seem vague or nonspecific at first, understanding the connection between these symptoms and pancreatic function provides a crucial window for early detection and possibly better treatment outcomes. 2. Fatigue or physical weakness. Pancreatic cancer can steal the body's strength in a way that goes far beyond normal tiredness. This isn't the kind of fatigue you feel after a busy day or poor sleep. It's a deep, relentless exhaustion that stays with you no matter how much you rest. Even after a full night's sleep, you may wake feeling as if you barely slept at all. Inside the body, cancer cells compete with healthy cells for energy and nutrients, slowly draining the body's reserves. Simple daily activities like walking, climbing stairs, or lifting light objects can suddenly feel overwhelming, making everyday life a constant struggle. But it's not just the body that suffers. This physical weakness is often accompanied by emotional challenges, including feelings of sadness, anxiety, or frustration. Many people also experience disturbed sleep, which only deepens the exhaustion and creates a cycle of both physical and mental strain. What makes this fatigue so dangerous is how easily it's mistaken for stress, aging, or overwork. Unlike normal tiredness, It doesn't improve with rest or relaxation. Instead, it lingers and slowly gets worse over time. Recognizing this persistent, unshakable fatigue is key to seeking medical attention early, as it may be one of the few early clues in detecting pancreatic cancer. 3. Fever and shivering. Fever in pancreatic cancer often signals your body's response to the disease's inflammatory effects. When your pancreas becomes inflamed, it triggers your immune system's natural defense mechanisms. These temperature changes can be particularly confusing because they often come and go. You might experience episodes where you feel intensely cold and shivery, followed by periods of high fever. This pattern is different from the steady fever you might experience with common infections. The combination of jaundice and pancreatic inflammation can create a perfect storm for temperature irregularities. Your body is essentially fighting on multiple fronts, dealing with bile duct blockage, inflammation, and the cancer itself. When these fevers occur, they're often accompanied by night sweats and general discomfort. Unlike viral infections that typically resolve within a week, these temperature variations tend to persist or come back repeatedly. 4. Blood clots. One of the most often overlooked and underestimated complications of pancreatic cancer is its profound effect on blood clotting. While many associate cancer with tumors or pain, few realize that pancreatic cancer can quietly set the stage for dangerous blood clots. This condition, known as hypercoagulability, means the blood is much more likely to clot than normal, especially in the deep veins of the legs. Deep vein thrombosis, DVT, is a frequent result, typically appearing as unexplained leg swelling, warmth, tenderness, and a reddish or bluish discoloration in the affected area. While these symptoms may seem minor at first, they carry a hidden danger. If a part of the clot breaks loose and travels through the bloodstream to the lungs, it can trigger a pulmonary embolism, a life-threatening medical emergency. What makes this process so alarming is the underlying cause. Pancreatic cancer releases inflammatory substances that upset the body's natural clotting balance, tipping it dangerously toward excessive clot formation. This creates a perfect storm inside the body where clots can silently develop without warning. The warning signs of a pulmonary embolism are unmistakable and should never be ignored. Sudden shortness of breath, sharp chest pain that worsens when taking a deep breath, and a rapid or irregular heartbeat. When these symptoms occur, they demand immediate emergency care, as minutes can mean the difference between life and death. Understanding the link between pancreatic cancer and blood clots can help patients and families stay alert. Recognizing that unexpected swelling or breathing difficulties may be far more serious than they appear, and seeking help without delay can save lives. 5. Swelling of gallbladder or liver. When pancreatic cancer develops, it can create a cascade effect in nearby organs, particularly affecting your gallbladder and liver. These changes occur because pancreatic tumors often block the bile duct, the vital pathway that carries bile from your liver to your small intestine. Your gallbladder, normally about the size of small pear, can become noticeably enlarged when bile backs up. This enlargement happens because your gallbladder continues to store bile, but can't release it properly due to the blockage. Similarly, your liver might become swollen as bile accumulates within it. This swelling can sometimes be felt during a physical examination, appearing as a firm enlargement beneath your right rib cage. Modern imaging techniques like CT scans and ultrasounds can clearly reveal these changes. 6. Gas or bloating. Pancreatic cancer can significantly disrupt your digestive comfort in ways that many people don't expect or recognize at first. The pancreas plays a key role in producing enzymes that help break down fats, proteins, and carbohydrates, ensuring smooth digestion and nutrient absorption. When a tumor develops in or around the pancreas, it can interfere with this delicate process, leading to sensations of unusual fullness and persistent bloating. One of the earliest and most telling signs is a feeling of early satiety, the sense of being full after eating only a few bites. This happens because the growing tumor can press against nearby structures like the stomach or small intestine, limiting space and altering digestion. As a result, meals that once felt normal can suddenly leave you feeling bloated, tight, or even slightly nauseated. Unlike typical digestive discomfort from overeating or minor stomach upset, the bloating seen in pancreatic cancer tends to be persistent and stubborn. It often doesn't improve with common over-the-counter remedies like antacids or dietary adjustments. The abdomen may feel noticeably swollen even when you haven't eaten, and the sensation can last throughout the day, making it difficult to ignore over time. What makes these symptoms particularly concerning is how easily they can be brushed aside or misinterpreted. Many individuals assume they're dealing with stress, indigestion, or age-related changes, delaying medical evaluation. But when feelings of bloating, fullness, or abdominal tightness continue for several weeks without clear explanation, they deserve careful attention and medical assessment. Recognizing these subtle but persistent digestive changes could offer a crucial window for early detection and intervention in a disease that is often diagnosed too late. 7. Tummy or back pain. The location of pancreatic cancer pain can reveal crucial information about tumor location. When cancer develops in the body or tail of the pancreas, patients often experience a distinct type of discomfort that's hard to ignore. Imagine a dull, persistent ache that feels like it's coming from deep within your upper abdomen. This pain often radiates to your back, creating a band-like sensation across your torso. Unlike typical stomach aches, this discomfort tends to worsen after meals or when lying flat. Your pancreas sits in a complex network of nerves and organs. When a tumor grows, it can press against these surrounding structures, triggering pain signals. Some patients describe it as a gnawing sensation, while others compare it to a constant heavy pressure. The pattern of this pain is significant. Initially, it might come and go, giving you periods of relief. However, as the disease progresses, the pain often becomes more persistent and intense. Understanding your pain's characteristics helps doctors differentiate between pancreatic cancer and other conditions. The timing, location, and nature of the discomfort provide valuable diagnostic clues. 8. Dark yellow or brown urine. Your urine color can tell a powerful story about your health. When pancreatic cancer develops, it often affects your bile duct, leading to a condition called jaundice. This occurs when bilirubin, a yellowish compound produced during the breakdown of red blood cells, accumulates in your body. Normally, bilirubin is processed by your liver and eliminated through stool, giving it its brown color. However, when pancreatic cancer blocks the bile duct, this system gets disrupted. Even if you're staying well hydrated, your urine might take on a dark yellow or brown shade, similar to the color of cola or strong tea. This change happens because your body is desperately trying to eliminate excess bilirubin through alternative routes. Many people dismiss this symptom, attributing it to dehydration or dietary changes. However, if this color persists for more than a few days despite proper hydration, it warrants immediate medical attention. This discoloration often appears before other visible signs of jaundice, such as yellowing of the skin or eyes. Understanding this early warning sign could be crucial for early detection. Conclusion: pancreatic cancer is often silent, but its impact is anything but. What makes it so dangerous is not just the disease itself, but how easily its symptoms can be ignored, disguised as harmless digestive issues, fatigue, or simple discomforts. Yet, as we've seen, these signs are far from ordinary. They are your body's quiet alarms, trying to tell you something is deeply wrong. By recognizing even a few of these early symptoms, whether it's dark urine, unexplained fatigue, sudden bloating, or persistent back pain, you may be giving yourself or a loved one a precious advantage. Time. Time to seek help, time to act before it's too late. The truth is, knowledge saves lives, and sharing that knowledge can save even more. Remember, your awareness today could mean someone's survival tomorrow.